Hello and welcome to the Going Viral podcast. I'm Matthew Zinder, a certified registered nurse anesthetist. I'm an advanced practice nurse that specializes in the practice of anesthesia. The scope of this podcast will explore health and wellness from the broad to the specific. My aim is to educate while offering a unique perspective. Thank you for joining me today, and let's get right to the show. So today I talked to a physician who specializes in infectious disease, and obviously it's very timely to discuss the coronavirus with him. His name is Dr Mohomid Al-Ibrahim, and he works at a pharmaceutical research company called Pharmaron. He gives many good insights on many of the topics that are discussed quite often in the media and online. Unfortunately, there are a lot of misconceptions out there, and that was one of the things that I wanted to address with him. Now, as you listen to this, please bear with me. Again, this is all new to me. I'm trying different platforms for recording these shows, one of which is a platform online called Squadcast. I'm also using a recording platform for Skype. We actually did Skype this interview, and Dr. Al-Ibrahim is sitting in his kitchen, so you will hear some background noise of his family because he is at home, as we all are, or most of us are. So you will hear some background noise. I apologize for that. I'm also going to keep working on it to see if I can clean up the sound a little bit better, even on my end, because I know there is a little bit of an echo. But I do appreciate you bearing with me. I also really appreciate the comments that I have gotten from people that have listened to the podcast. It really does help me improve things. It helps me come up with questions for the interviews. And it is nice to know that some people out there are listening. So thank you very much for that. I have also gotten my act together a little bit more as far as communication is concerned. So if you want to email me any questions or constructive comments, you can go to goingviralpodcast@gmail.com and email me. And there is also a website that holds all of the shows all together and a player if you want to listen to it that way. And that is goingviral.buzzsprout.com. Buzzsprout is actually the platform that holds the uploaded recordings. So, with all that being said, please continue to share this. And without further delay, here is my talk with Dr. Al-Ibrahim. Okay, so today we are talking with Dr. Mohomid Al-Ibrahim, and I just wanted to start with having you tell us a little bit about your background, and then we can get into the discussion.
Thank you, Matt. I'm a physician. I graduated from the University of Baghdad College of Medicine, came to the United States to do a residency in medicine and a fellowship in infectious diseases. I have been a infectious disease practitioner and spent most of my career at the University of Maryland School of Medicine in a variety of roles. I was a professor of medicine at that institution and associate dean for Veterans Affairs. In 2006, I joined a company, a startup called Shin Nippon Biomedical Laboratories, which was a clinical pharmacology center for drug development. I have worked since that time on probably 200 research projects, mostly early phase research. 2 years ago, the company was acquired by a Chinese pharmaceutical company called Pharmaron, and I have been the senior research physician for Pharmaron since 2017. So that's where I am.
Obviously, this situation right now with the coronavirus that's affecting the world is quite timely, and your expertise, I'm sure, has been tapped by many sources. You and I have known each other a few years now and worked together, so I appreciate your time very much on this, and any information that you might have to add to help people understand this a little bit better. I could start with, our discussion with really generalities, meaning What kind of insights might you have on how this virus is different than what one might just be used to discussing or dealing with?
That's a good start. We, of course, know a lot about the family of viruses, the coronaviruses. We know, of course, that they are the most common viruses that cause the common cold. However, every now and again, they have caused very serious disease with not the kind of mild symptoms of the common cold, but with respiratory complications leading to death. So we had what's called SARS-1, which is a coronavirus that caused fairly severe disease, and it was in the early 2000 era. We also know another coronavirus that causes severe symptoms called MERS, which stands for the Middle Eastern Respiratory Syndrome. This virus is different in several respects. First of all, it's much more infectious than SARS and MERS. Many asymptomatic people can disseminate this virus. The other thing about this virus is that it's also much more serious than the common cold. Worldwide, it's causing between a 1.5 and a 2% mortality. In some countries, much more so than others. In the comparison with influenza virus, which causes death in less than 0.1% of cases. So this is several orders of magnitude more serious as far as mortality is concerned than influenza. And as one can see from our own country as well as from the rest of the world, it can be fairly explosive.
One of the things that I'm seeing, in a lot of the news and the literature out there, and the little bit of research that has been done in the short amount of time that researchers have had to put things out as far as papers are concerned, one of the things that is striking about this particular virus is the lack of symptomology and the inconsistency of symptomology, and it's actually starting to come out. Correct me if I'm wrong. In the beginning, they were saying, well, this is an old person's disease. You're only going to have trouble with it if you are over 60 or 65, or you have a pre-existing condition. But now, as we're into it a little bit more, a month into it or more, it's showing that is not the case. Is that correct?
Yes. Part of the problem about drawing conclusions is the fact that in most countries, unfortunately, especially in the United States, we have just not tested enough people to get a true idea of the number of asymptomatic people, for example. And that's why we have not been able to identify and manage the clustering of cases very well. We've always been 2 weeks behind the times, as it were. So that's a huge problem. But somewhere near 40, 50% of people perhaps have no symptoms, or so little in the way of symptoms that they don't recognize. And then the rest do have symptoms. Majority of them are symptoms that are relatively mild or moderate, but then in some 15 to 20% of cases, what it seems to be is that they are more severe and may require hospitalization. The runny nose, sore throat, headache may be very mild. The more serious is when there is shortness of breath and chest pain, which can be due to a variety of causes. The pneumonia in many individuals seems to be peripheral towards the pleural surfaces, which is more symptomatic, causing chest pain. But then there are often other possible causes for the chest pain, like pericarditis, for example. And then the more severe symptoms are severe shortness of breath, sometimes confusion, sometimes people turn actually blue because of cyanosis and hypoxemia. And of course, that's extremely serious at that point. So one of the challenges is people are advised to stay home as long as possible when they have symptoms. The challenge is at what point is there danger and they should be immediately going to the hospital or seeking professional medical care.
And at that point, that's pretty much when people are having respiratory distress.
That's correct, yes.
Right. So at what point do you think, or in your opinion, if a person has experienced the telltale symptoms, let's just say they were not tested because of the shortage of tests, but they had the fever, they had the shortness of breath, they had the chest pain, pretty much, let's just say it's textbook, and they did the right thing and they self-quarantined for 2 weeks, and they started to feel better at those 2 weeks. At what point would you say that it's okay to end your quarantine?
Yes, that's a good point. There are several recommendations. Part of the problem is that we don't have the clear-cut mechanisms of testing. So, for example, the CDC has recommended two kinds. One of them is nucleic acid testing, which is the usual diagnostic test with the PCR kits, that there would be two negatives before somebody is considered that allowed to go back and are free from virus. The other is based on resolution of all symptoms and 14 days from the beginning of illness, and resolution of all symptoms for 3 days, including fever and all of the other things. So that's where we are. Right now, it's impractical to test somebody twice. We're lucky if we can get them tested once.
Right.
So that's a huge problem.
So pretty much the idea would be free of symptoms. So we haven't really seen. So we know that some people can be carrying it free of symptoms or have no symptoms, and then for up to 5 days, I think is what I've been hearing, and then and that's why the spread is so bad, because you are carrying it without knowing that you have it. Then you may or may not experience symptoms after that for a period of up to 2 weeks. But has anything been shown on the back end? Meaning, could you have had it and your symptoms resolve, and could you still be a carrier after you've already had the symptoms? In other words, on the back end.
It really is unknown. It's unlikely by our experience with this type of virus. They're not usually carried. One doesn't see carriers for weeks and months. What we know, for example, is that, and that information comes from China as well as with others, is that you might be able to detect viral RNA in people for as long as 21, 22 days. But it's not known whether that actually these virus RNAs are infectious or just remnants of virus that can be picked up by these probes.
So it stands to reason that it may be a good idea to continue a quarantine, at least for a few days, even after you're free of symptoms, just because of that unknown.
The recommendation is that the people are quarantined for 14 days and for at least 3 days after they become symptom-free.
Okay. And what is your opinion of whether or not a person is immune after experiencing it?
Well, again, we don't know. What we do know about coronavirus, at least we don't know accurately about this coronavirus, but what we do know about previous coronaviruses is that immunity generally is not long-lived. So it may be on the order of months or a year, but not forever. It's not like a yellow fever or whether it's from natural infection Of course, we've never had a coronavirus vaccine. So that's an unknown too.
Which is part of why this has become so difficult, I guess, is all of the unknowns and how new this is.
That's correct. There have been previous efforts to work on a coronavirus vaccine with SARS-1 and with MERS. Unfortunately, the funding for continued development of these vaccines stopped when the outbreak stopped.
From some feedback from a listener actually wanted to know a little bit more detail, and I thought you would be the perfect person to ask this, but obviously it's intuitive as to why everyone, every news outlet, every piece of literature out there is saying, wash your hands, constantly wash your hands. But it actually can go a little bit deeper than just the concept of washing the virus off your hands, doesn't it?
Well, the virus is pretty fragile. It has a lipid covering, and with detergents like soap, that actually denatures and removes that lipid, if you will, protective covering. So they die. They die fairly quickly. And the other kinds of compounds out there, many of them also affect the lipid, like alcohol, for example, and that also kills the virus.
Now, when a person uses alcohol as opposed to soap and water, like kind of the Purell or even just straight rubbing alcohol, I actually carry, and I used to carry this around even before this all started, just because I'm a healthcare provider and like to have clean hands. But I've always carried a little tiny spray bottle with me in my pocket with straight 91% isopropyl alcohol with some essential oil in it. And I spray that on my hands a lot. Is the rubbing still absolutely necessary, as you would need to do when washing with soap and hands? And if so, is it still the 20 seconds?
20 seconds seems to be a good time. The old experiments with hand washing, which mostly looked at bacteria as opposed to viruses, showed that the detergent effect of soap removes much of the stuff that is stuck to our skin, and with it also the bacteria and the noxious things. So soap has an effect that goes beyond the rubbing of alcohol for 2 seconds, 3 seconds. If you rub with alcohol, yes, it is effective, and especially if you wait till it dries, so that the effect is, and you rub it well between your fingers and everywhere. But washing with soap is very effective at removing all of that sort of little microscopic debris that germs hang on to. And then, of course, it has the effect on the germs themselves.
Right. Okay. So, and I keep going back to this subject, and any of regular listeners of this podcast will recognize this, because I am concerned about it, and that is the whole concept of healthcare providers going in to take care of COVID-19 patients, and they're following all of the proper procedures with personal protective equipment. Let's say they work in a hospital with everything that they need, and then they're protecting themselves properly, but then they're finishing their shift and they're going home and they're thinking nothing of decontamination. In other words, they're going home probably with it on them. It's just not on their radar to think about decontamination because we've never been trained in it. I used to work in the surgical intensive care unit 25 years ago, but lots of things happen there that you would consider probably contamination related. And I would just go home and I'd change out of my scrubs and I'd jump in the shower and I'd be done. But in this case, this is so much more serious. And in a couple, previous episodes to this, I spoke to a hazardous materials expert, and he believes that there should be hazardous or hazmat tents set up outside of every hospital for healthcare providers to walk through to go through a step process of decontamination, which is obviously doesn't exist right now. So more than just washing hands, it's something of a concern because healthcare providers could be inadvertently leaving their facilities and infecting themselves or their families, or God forbid they go to the grocery store on the way home, something like that.
Yeah, many healthcare providers are going the extra mile. They go home, they wash all their clothes they wore that day, they make sure nothing touches other surfaces, because we know that this virus can survive on surfaces for as long as 72 hours, depending on the surface itself. Now, it is true that by 72 hours, there is only a fraction of the virus left from the beginning, but it's still there. And while we don't know how effective the leftover virus is in terms of the amount, we do know that it can be detected. So until we know better, we have to presume that you can carry this around with you.
I'm wondering what your thoughts are on just kind of the concept of how this is transmitted. Obviously, we did kind of already touch on how it lives on surfaces, how you can pick it up with, your hands, or you can pick it up on your clothing, or depending on how protected you are, or, how you're observing social distancing. But this is an airborne illness. And I'm just wondering, for people that are wondering, let's say you're standing in line at the pharmacy or standing in line at the grocery store and someone is doing something as simple as breathing. Can you walk through a cloud of virus in that respect? Or is it someone that would have to cough? Or is 6 feet enough for the virus to go from that aerosol cloud to the ground before you get to it?
Well, I think all of us have stood 2 or 3 feet away from somebody just talking normally.
Sure.
And sometimes you get splattered with a little bit of aerosol.
Right.
So we know that happens. I'm sure that droplets can travel 4 or 6 feet. Obviously, there has to be some practical distance that you say to people, keep away from each other. It's not going to be possible to do it 12 feet away. So there's a lot of discussion about this in terms of how much virus can be carried in the ambient area to someone who's infected, and how long droplets will hang on. This is very basic, but very difficult kind of science. There's somebody actually here at the University of Maryland who has done research on influenza transmission by getting people together in a room, how many people are infected, donor, i.e., that is donors of the virus, to recipients who are naive and who have not been infected, what kind of contact for surfaces as well as the air. And these are very difficult studies. There aren't really enough of them to give us a very accurate idea. But there is, I think, from a very infectious virus, there is concern that we are not, for example, using masks, even surgical masks, when we leave our houses. As you know, the Chinese use that, and they were sticklers about it. And personally, I believe that this makes a lot of sense. The CDC has finally come down and or come out with recommendations for people to do that when they go to the store, when they leave the house, even for going on a walk where you expect to see somebody on the way, and that's certainly most of urban life. it's impossible not to have somebody go by you. Um, so even without knowing precisely that science, I think that is something that we should follow while we're following all of the other strict distancing strategies.
And it's an interesting point that a lot of people think possibly that if they were to wear a mask, a surgical mask specifically, or a scarf, there's lots of DIY masks now that are coming out. They're trying to make sure that people understand that that mask protects others from you. It does not protect you from others. But if everyone wears one, then everyone is then protected. But it requires a community response and participation. Whereas if you were to wear technically wear an N95 mask and wear it properly, then that would protect you from others. But again, there's the shortage, and you have to leave out those available masks for the healthcare providers because of the highly dangerous environment that they're working in. But if everyone did as a community participate in this, then they would be protected, or everyone would be protected, because that mask is holding in whatever germs a person may have, whether it's the virus or not.
Yeah, I was very proud. I talked to 3 patients earlier today who are at home, and they are all using homemade masks when they go out.
That's very good, yes. As far as treatment modality, I mean, where are we headed when it comes to that? Or, I know there's a lot of rumor. What are your thoughts on treatments, if any? And then also, if you could comment a little bit on where we might be with vaccine, and then of course the convalescent serum.
I think it's fair to say that at the moment there is no proven treatment. So treatment is based, for the most part, as supportive therapy. So to go through quickly the list of possible treatments, as you mentioned, hydroxychloroquine, which is an anti-malarial drug, is also given in other situations, for example, lupus. There have been reports of early viral clearing. There are trials going on. It has not been proven to be effective at this time. And that's the case with other treatments. The most promising antiviral treatment right now is one drug that's called remdesivir, which is made by Gilead. It's being given to about 1,500 people all over the world, but it's the proper scientific trials, randomized, double-blind, have not been completed, and we don't have the data from those. There's another antiviral that is made by Japan, by a company which is known to be in the photography industry, Fuji, but they are now a pharmaceutical company also, and that's a drug that is an anti-influenza drug that there were some reports that it might be beneficial, but again, the randomized trials are ongoing and we don't have data from that. Then there's there are other antivirals being considered, but again, no clear-cut data. The plasma transfusion, where plasma is taken from individuals who have had the virus and who have antibodies, is an old world kind of treatment. It is still, by the way, even in the modern era, useful. It was given to, there's RSV, respiratory syncytial virus, immunoglobulin. We used to use it a lot for preventing hepatitis A when there was no vaccine. It's also given to, it's one of the few things that are available for treatment of rabies. So that is now actually ongoing trials. The biggest trial that I'm aware of is in the Mayo Clinic, where they are using this. It's complicated by the fact that it only is possible when there's a large pool of immune people to collect this from. Also, what we know about this kind of passive immunity is that it's more effective when given early in the disease and not when you are overwhelmed. So it has that kind of potential, but that kind of drawback at the same time. Then there are other issues about treatment, which is, should you give non-steroidal anti-inflammatory agents? Because there has been some reports that people seem to be worse when they, let's say, take an ibuprofen or naproxen. We really don't know. Many practitioners are staying away or recommending staying away from that just on the basis of those kinds of reports. Similarly with steroids. Steroids could be helpful in some of the pneumonias that we treat normally, but again, the fear is that the depression of the immune response could be deleterious in this virus. Again, we don't know. So there we are, and of course, everybody is looking forward to development of a vaccine, which is a different kind of story.
Best guess on how long that might take? I'm hearing 18 months.
Yes. So I would imagine at least there are, I would say, probably about 30 companies that are in the process of making a vaccine. Two have actually been have been started already. One on the West Coast and the other one in Philadelphia. And so the general format for development of a vaccine is that you go through a phase 1 where you have increasing in small groups of people, like 6 or 8 people in each group. So group 1 will get the very small amount of the dose of the investigational vaccine, and that increases. And then there would be, first of all, safety. So the first cohorts would be just safety, not efficacy, although, of course, the antibodies that would be generated or not generated, but they would be measured. And then once it is established that a high enough dose of vaccine that gives a high enough titer that's believed to be protective, then you go to the efficacy trials. You go to a phase 2 and a phase 3, where you are then looking at the protective effect of these vaccines. Typically, in the past, these have taken 2, 3, 4 years to develop. Ebola created a need for a very rapid development, and that took about a year and a half, 2 years. So we're thinking that maybe we can accelerate it even faster to a year or a year and a half. That's the current thinking.
What is your best guess on how long it's going to take for us to get completely to the other side of this?
Yeah, I think that's a really good question. We should be thinking about a vaccine for the second wave or the third wave of disease that will come after 2020. So the development of an antiviral may be within reach before that, hopefully. That within the next 6 months, we may have data to show that this or that antiviral might be effective or at least helpful.
Why are viruses hard to treat in general?
One of the things that's unique about them is they come and hijack our cells to make themselves. And that's very kind of difficult to treat, So there is the entryway, which can be, if you have a successful vaccine, it can prevent the entry of the virus to the cells and hijack it to make more virus. The other is that because it's in our cells and basically all over the body in most situations, it's hard to get a chemotherapeutic to kill it and not also be very toxic to cells.
Well, Doc, I really appreciate your time very much. Is there anything else that you would want to make a point of or get across at all?
I still think that it's worth to emphasize that the quality with which we mitigate getting infection is one that eventually drifts down to each person, and that the more individuals who take this seriously, then the more the common good would be.
My question really is, at this point, how much longer are we going to be experiencing this very surreal time that we're all in? I can tell that you're working from home just like I am. That can only be so long sustained as far as the economy is concerned. So hopefully we will all come out the other end of this safe and healthy, but at the same time back to as much of a normal capacity as possible.
We hope so.
So thank you very much again for your time and your expertise. I'll look forward to talking to you again.
Thanks, Matt, and thanks for having me.
Okay. All right.
Bye-bye.
Bye-bye. Thank you. So thanks for joining me on this 5th installment of the Going Viral podcast. I appreciate it very much. Please remember to share this with anyone who might be interested or anyone who might benefit from the information. Please stay tuned. We have many episodes coming up, including an interview with an aerobiologist who will actually talk about the science behind how this virus reacts in the environment. I'll be talking to an RN who has been teaching his colleagues how to don and take care of personal protective equipment because he has experience taking care of Ebola patients, and he'll also talk about that experience. Plus, I will be talking to both a CRNA and an anesthesiologist who are both in the front lines. The CRNA is actually going to be working at the Mount Sinai Hospital in Manhattan, and the anesthesiologist is working in the Carolinas. Both are going to be on airway teams coming up here in the coming weeks. And I know I keep promising to do some episodes on stress management techniques, so I do promise that they are coming up as well. So thanks very much again for listening. So that'll do it for this episode. I hope to see you at the next one. This is Matthew Zinder and the Going Viral podcast. Please stay safe and stay well.